Well, it was really important to involve a broad array of partners in our process, and the timing was really well suited to involve the hospitals because they are doing their community health assessments because of a new IRS ruling, and so they were interested in joining us. The health plans in the state of Minnesota have to create a collaboration plan, and so they were also interested in some mechanism that would pull together all of this assessment and planning so that we could have more of a collective impact on our work. So they were really foundational co-partners with us in public health. Then beyond that, we thought, who are important players in impacting health? And we know that education is an important place, both for where people are, but also the success people have in education affects their health. So we pulled them in. We worked with, we have an Office of Minority and Multicultural Health in the State Health Department, and we asked them to join us and also to help us engage a broader array of folks representing different cultural communities.
We have a lot of partners involved in the process, and that starts at the very beginning. We have what we call the Alliance, which is the CEOs of our 2 local hospitals and our health department, and they're really the guiding force behind this. And so they've really, been the people who've not only put forward staff members, but some of that cash to make some of the community health assessment happen. And then in the implementation phase, that's where we've really reached out to our partners. And we do a little different structure with our coalition. We have a broad coalition, and then the coalition is broken up into work groups. So the work groups get really specific, and it allows us to bring in those people who have expertise in a certain area, but don't necessarily want to attend the broader coalition and talk about those bigger pieces. For example, we have a built environment work group where we've brought in our transit agency, our planning, public works, the Montana Department of Transportation. And so just this broad array of people, and not all of them attend the broader coalition, but it allows us to really hone in on their expertise and use them for the pieces we want, and then they don't have to do all the other pieces that they're not interested in.
In a smaller community, we're just too big to be little and we're too little to be big. And so in our community, there are 3 hospitals. And so we have to be aware of kind of the political issues that go with that and the referrals and all of those things. And so having a group of those people in the room together and having them say what the issues were in our public health system, aside from these classic public health prevention issues, was very interesting, and it was very dynamic. And so they came up with 6 strategic objectives. 3 of those were focused on the public health system, i.e. themselves, and then 3 were focused on prevention, so on the obesity and the tobacco and the behavioral mental health issues. And so they, as a group, are responsible for recruiting people to help in these efforts. They, as a group, are responsible for setting what their objectives are and how to achieve that strategy.
We have definitely started engage the hospital in more conversations. It is interesting to see how this is evolving, where the hospitals come to the health department. And of course we both provide healthcare, but from a different level, a different perspective. But it's actually been a very beneficial thing to see that the hospital is coming to us for that public health information and advice. And that they're now very much engaged in seeing the disparities and inequities in the community and working toward improving health.
These 50 organizations, these 70 partners that have come to our conferences that we are continuing to hold, and we actually have one next week where we're really even digging deeper into setting goals and strategic approaches. Because we have kept it neutral and unified ground, it really has, I think, contributed to the integrity of the process. Right. And now we have residents that want to become engaged through these conversations, and really will hold us to what we said to them, which is, let us help you, but we really need to hear from you what you need from us. And so
I think Allison hit it on the money. It occurs to me another great story was from a community advocate who was part of our group, who I've known for a long time, and she's always a straight shooter and doesn't pull any punches on what her position is. And early in the process, she said to me, Terry, is this just about getting accredited, or do you want to get something done through this health improvement planning process? And we looked at her and said, Gail, we want to get something done. We want a community plan. We want to move toward implementation. Accreditation is part of what we need to get done, but the first and foremost, we want to make sure that we have a plan that gets implemented that makes a difference in this community. And she looked at me and said, okay, then I'm in.